Hello everyone. Myself Dr. Kushal Salunke, Junior Resident and Demonstrator in Department of Biochemistry, GMERS Medical College, Guthrie, Vadodara. So in this practical, we are going to discuss on chemistry of normal urine. Okay, in this particular practical video, we are going to discuss a normal urine practical. So urine mein we have two practicals. First is of normal urine and second practical will be of abnormal urine. So what is here meant by normal and abnormal? So you have to detect what are the normal substances or solids present in the urine normally. Okay, and what are those substances which will be present abnormally, okay, in a urine. You have to measure that. This practical is also included in a qualitative analysis, okay, that you have performed for carbohydrates and proteins as well. Okay, so in this particular video I have covered everything that you may require or you must be requiring for your practical UG examination and Viva, and I will be giving you the extra age information also whenever it is required. Okay, so stay tuned till the end of the video. Okay, obviously this video will gonna be longer little bit, okay, but you will be enjoying the session. Okay, so let's start with the chemistry of normal urine. Okay, so chemistry of normal urine. So how urine is formed and what is a urine? So urine is an ultrafiltrate of plasma. First point you should note is a urine is an ultrafiltrate of the plasma which is produced by the nephrons through a combination of three processes that you must be learning in the physiology, that is glomerular filtration, second one is a tubular reabsorption, and third one is a tubular secretion. In the filtration there is a passive filtration of small molecules. Okay, in the absorption selective uptake of water, ions, glucose and amino acid is there, and secretion means some amounts of solute will be secreted like some drugs like potassium ion and H plus ion that will be actively secreted as a waste product in the urine. Okay, right, I hope this thing is clear. So it will represent a final excretory product, okay, final excretory product of all the metabolism, and it will reflect your first thing, that is a renal function. Okay, renal function, hepatic metabolism also, like how the urea cycle is working, how the conjugation reaction is working. We will be seeing what type of test we are doing in the urine, and we will be discussing what is the clinically correlation in it. Okay, metabolic integrity also, how the protein metabolism is happening. Okay, and what is the end product of this particular metabolism which is excreted in the urine. Okay, carbohydrate and lipid metabolism as well. So it will reflect the renal function, hepatic metabolism and overall metabolism integrity. Okay, now first we want to discuss is our physical properties or physical characteristic of normal urine. Okay, we want to discuss physical properties and physical characteristic of normal urine. So what is normal volume? First parameter is the volume. So volume is 1000 to 1500, that is 1500 ml per day. So average 1.5 liter of urine per day a normal human is excreting. Okay, so now how the urine volume is determined? By it is determined by glomerular filtration rate. Okay, it is also going to determine by, first it is going to determine by GFR, second one it is also going to determine by ADH hormone, antidiuretic hormone, which is synthesized in hypothalamus and is secreted, stored as a hormone in a posterior pituitary gland, and it is released from the posterior pituitary gland. And also the fluid intake. Okay, whatever amount of fluid you are taking in, that is also going to determine your urine volume. So what is polyuria? First point to note, polyuria, when a urine volume is more than 2.5 liter per day, which is seen in diabetes mellitus. And why it is seen in diabetes mellitus? Because in the diabetes there will be insulin deficiency, either it is absolute or it is relative. Okay, so whenever there is insulin deficiency, okay, your blood glucose regulation is hampered. So in the blood glucose is very high. Okay, so whenever the blood glucose is very high in the blood, okay, it will exert an osmotic effect. So it will draw the water from whatever, wherever the glucose is present, it will draw the water. Okay, so it will draw the water from the body, so there will be high amount of urine volume. Okay, as well as diabetes insipidus also, there will be a high amount of urine volume because of ADH deficiency. Okay, antidiuretic hormone, if you break the words, diuresis means the urine excretion, antidiuretic means वो hormone जो diuresis को कम करेगा. Okay, so whenever the ADH is deficient, this condition is called as diabetes insipidus. It will be difficult for water reabsorption. Okay, ADH hormone will be reabsorbing water from the renal system. Okay, what is oliguria? The urine output, whenever the urine output is less than 400 ml per day, like in case of dehydration. Okay, shock. Why shock? Because in a shock is a state of hypoperfusion. What is shock? This is state of hypoperfusion. Okay, there are so many types of shock you must be learning in your medicine classes and pathology classes. Okay, we are not going into the detail, but in the shock there is a state of hyperperfusion to particular organ. Okay, so blood supply ही that particular organ को कम मिलेगा. So GFR that will be reduced, so urine output ultimately that should be reduced. Okay, renal failure also, whenever the kidney is not working, in case of chronic kidney disease, the ultimate urine output is reduced. That's why it will result in a oliguria. And what is anuria? When urine output is reduced up to less than 100 ml per day, that means obstruction by a stone. Okay, whenever in the ureter or urinary vessels you will be having a stone obstructing it, and some condition like acute tubular necrosis, there will be an anuria. Okay, right. Now appearance is fresh. Whenever the fresh urine is there, it is clear and transparent, and in the standing it will become a turbid. Okay, right. So bacterial ureases hydrolyzes the urea, and this will lead to ammonia and carbon dioxide. So whenever the ammonia is increased, your pH of the urine is increased, it will precipitate few ions like phosphate and carbonates and urate source, and this will result in a turbidity. So this is the reason why on standing the urine become turbid. Okay, persistent turbidity may also suggest you of urinary infections, like some organisms, gram negative organisms like Proteus and E. coli will be more causing a urinary infections. Okay, that's why the turbidity also indicates the urinary infection. Okay, now let us talk about the color. So pale to amber yellow is a color of urine, and this color of urine is due to one pigment that is called urochrome, which is a derivative of oxidized urobilinogen. And urobilinogen is ultimately derived from a hemoglobin catabolism. Okay, so heme catabolism से urobilinogen बनता है, and this will be forming a urochrome, and this will impart amber yellow or pale yellow color to the urine. Okay, other pigments like uroerythrin will impart a pinkish color, urobilin, that is yellow to brown color. And what are the variation? When the red color urine is forming, it is either due to hematuria or some hemoglobin metabolism defects like porphyrias. Okay, you will be learning in the hemoglobin classes. Brown color urine is actually due to myoglobin. So whenever there is a acute tubular necrosis, there will be a release of myoglobin from the muscles, like in the crush injury, and bilirubin anemia, like a jaundice like condition, there will be a brown color urine or dark yellow color urine. Milky urine will suggest a chyluria or pyuria. Chyluria means there is a chyle. Okay, so there is a lipid amount is more in the urine, and pyuria means pus amount is more in the urine. I hope this thing is very clear to you. Okay, what is odor of urine? Odor, whenever the urine is fresh, it is an aromatic odor. And why it is aromatic? You will be asked in your Viva questions. Due to volatile organic acid, it is aromatic. And on standing, I have already told you there is a formation of ammonia. So this will lead to ammoniacal odors. Okay, so volatile fatty acid, scatol and indole contributes to odor. So fruity odor. Important point to note, it is due to ketone bodies like acetone, and it will be seen in the diabetic ketoacidosis. And fall odor, which will be due to infection. So example is Proteus infection, E. coli infection, there will be a fall odor of urine, that is very bad smelling urine. Okay, what is normal pH? Normal pH, you can note, it is mildly acidic, that is average is 6.0, and 5.5 to 8 is a average pH of urine. Okay, I hope this thing is clear. So why your pH, normal pH of the urine is acidic? Okay, this is very common question that is going to be asked in your Viva questions. Like, let us see the reason why normal urine is acidic. Okay, so you can see in the screen. So kidney will excrete a non-volatile acids. First reason why the urine is actually acidic, slightly acidic, because kidney will excrete non-volatile acids like sulfuric acid and phosphoric acid. Second point is active secretion of H plus ions, that is happening in the distal tubules and collecting ducts. Okay, so first reason is this. Second reason is this. Third reason is a filtered bicarbonate. So bicarbonate HCO3 minus, okay, will be filtered, and which is almost completely reabsorbed. So this bicarbonate is actually responsible for base nature. And if I 100% absorb this particular base, so my normal urine will be slightly acidic. I hope this thing is very clear to you. Very simple concepts. Third, for fourth, kidney will generate new bicarbonate by aminogenesis and phosphate buffering. This is why also that will a normal urine is acidic. Typical diet, like whenever the person is on high protein diet, okay, high protein diet, it will resulting acidic and metabolic products. So whenever you will be learning in the protein metabolism, protein का जो end product होता है metabolism का, that will be acidic and this will be secreted in urine. That's why the normal urine is slightly acidic. Okay, and why it is important, helps सिस्टमिक पीएच को 7.4 करने के लिए योर नॉर्मल यूरिन शुड बी एसिडिक. इफ यू आंसर दिस इन अ वाइवा, दैट विल बी अ वेरी गुड sign that you are going in a good way of viva. Okay, so this is the reason why normal urine is acidic. Moreover thing, the normal urine if it is slightly acidic, this will also provide antimicrobial nature. Okay, this is a normal thing that one should note. Okay, I hope things are very clear to you. Okay, so I hope you understand why the normal urine is slightly acidic. Okay, now next we will discuss about the specific gravity of a urine. This is very much important concept and many viva questions can be asked from this specific gravity concept. So normally you should ask, you should know what is normal range of specific gravity. So it is 1.012 to 1.024. Okay, and this will reflect, and specific gravity will reflect the urine concentration, so solute concentration per unit volume of a urine. This will indicating a specific gravity. Moreover, this will depends on two things. First, your ADH hormone, okay, and second one is a tubular function. Okay, two things, only two things, right? So whenever there is a high specific gravity, it will indicate that thing that urine contain high amount of solutes. Like what kind of solutes can be present in the urine? So glucose, when it is a glucose, it is a glycosuria. Whenever the urine volume is already low or urine is highly concentrated, like in case of dehydration, your water content is very low, so ultimate urine is formed is a concentrated urine. That's why there is a high specific gravity. In case proteinuria, that is seen in the nephrotic syndrome, the specific gravity of urine is also very high. Important point, low specific gravity. Low specific gravity of the urine, that means volume of urine is very more and water content of the urine is very much high and your solute concentration is actually a low. That is in case of diabetes insipidus and chronic renal failure, because in the chronic renal failure, I have already told you the specific gravity will be depending on the tubular function. So in the chronic renal failure, tubular function is not going to happen. So there is a loss of concentrating ability of urine. Okay. Now what is this? That is isosthenuria. Your specific gravity is fixed at 1.010 and this specific fixed gravity will indicate a severe renal tubular damage. You will be asked in your viva questions. Right, now let us discuss more about urine and the specific gravity. Okay, I will be taking you in slightly detail and how will you measure the specific gravity. Okay, this you should note. Okay, now see this. So how will you measure the specific gravity? The urinometer is the instrument that will be requiring to use to measure a specific gravity of urine. So it is a density of urine relative to water density. That water का density हम लोग 1 लेते हैं, ठीक है? You have to apply some corrections. What kind of correction I will be teaching you shortly. So first, you have to clinically correlate. I have already discussed, but particularly that persistent specific low gravity. Okay, low specific gravity will indicate a renal concentrating defects, like in case of diabetes insipidus and chronic kidney diseases. In case of high specific gravity, it will indicate proteinuria, glycosuria, and dehydration. I have already discussed this. Okay, this is the concept of specific gravity. Okay, right? Specific gravity का formula है weight of urine upon weight of equal volume of water. Okay. Okay, this thing is very clear. This also I have already discussed concentration of what is physiological and biochemical basis. So urine specific gravity will be depending on concentrating ability of urinary tubules, ability of solute load, which is filtered by glomerulus and reabsorbed by or secreted by the tubules. And third one is the hydration status, that of antidiuretic hormone. So what are the key determinants? Urea, sodium chloride, creatine, and uric acid. This will impart a major contribution to specific gravity. Okay, now I have to show you the procedure. Okay, so this is how we are actually measuring the specific gravity. You can see. Okay, I hope this instrument is visible. Okay, so you can see in the diagram, very clearly shown diagram. So this particular thing is a urinometer. Okay, urinometer, which is used to measure as urinary specific gravity. Okay, so you have to take a fresh urine that is up to 100 to 80 ml and you have to fill it in a cylinder. Okay, I will show you the procedure. How will you perform it? Okay, see this. So you have to take 100 to 80 to 100 ml, that is 3/4 volume of well mixed urine. So why well mixed? You have to avoid the air bubbles and frothing to avoid a misleading readings. Okay, gently lower the urinometer into it. You can see this. This is urinometer, and after filling the cylinder up to the here mark, okay, I have put the urinometer gently down the urinary container. Okay, so you do not have to touch the walls. Important point to note. And in a twirling motion, you have to put a urinometer in a filled cylinder. Okay, now you have to allow it float freely and you have to come it to the rest. Okay, now you have to note the reading at lower meniscus of urinary surface at eye level. Lower meniscus is very important. Okay, important point. It is very much important that if you take upper meniscus, your specific reading is a specific gravity reading is false. And then you have to record the temperature of urine, at what temperature you are measuring. Okay, that is also important. And then you have to apply the temperature correction. How we will applying the temperature correction, I will be discussing shortly. I hope this thing is clear. So you can see, for every plus 0.001 above 3, that is 3 degrees Celsius, above 15 degree, above 15 bar you have to take that reading only. But for every 3 degrees Celsius above 15 degree, you have to correct it by plus 0.001. Okay, this thing is clear. And important point to you should note also that our correction we are applying will be at 15 degree or 20 degree caliber. Okay, so if the temperature differs from the caliber temperature, usually we are taking 15 to 20 degree of calibration temperature, right? Now I will take the example so you will be having a clear idea what I am talking about. Okay, so I will be taking the example of it. Okay, just see. Yeah, see this. Okay, if my urinometer is calibrated at 15 degrees Celsius. Okay, right, so you have to add 0.01 for every 3 degree rise above 15 degree, and you have to subtract 0.01 for every 3 degree fall from below 15 degrees Celsius. Now I am doing the experiment and I have observed the specific gravity is 0.018. Okay, at you have applied the 27 degree. Okay, I have given you the temperature, that is I am observing it 27 degrees Celsius. Okay, so 15 से कितना ज़्यादा है? 12 degree Celsius is higher. And what is our formula? You have to add 0.01 for every 3 degree rise above 15 degree. So if you do 12 by 3, you have to add 4 into 0.001. Clear? Okay, so you have to make plus 0.004 correction to this much amount. So you can see here, you can see. Okay, you can see plus 0.018 में 0.04 का correction, so it will be leading 1.022. Okay, oh, I hope this thing is absolutely clear to you. Okay, you are understanding, right? Clear? सिंपल है, बहुत ही सिंपल कंसेप्ट है. सो व्हाट आर द प्रिकॉशंस यू विल बी टेकिंग व्हाइल मेजरिंग द स्पेसिफिक ग्रेविटी? यूरिन मस्ट बी फ्रेश. Standing can cause bacterial decontamination or decomposition. And okay, you have to avoid air bubbles and under the floating. Ensure the instrument when you are measuring it is very clean and dry, and do not let urinometer touch your cylinder wall. Okay, okay, I hope these things are very clear to you. Okay, right? Now what is total solids? Right, you can see now total solids are the solids which is present in the urine, and we are measuring it at totally. Okay, in total we are measuring how much total solids are there. Normally it is 25 to 60 gram per liter, and it is roughly calculated by using Long's coefficient. Okay, whenever you are measuring the specific gravity, okay, specific gravity can last 2 digits you have to take, and you have to multiply it by 2.6. And what it will include actually? Urea, creatine, uric acid, and salts and other pigments also. Right? Clear? I hope this thing is absolutely clear to you. Okay, so we have measured the specific gravity. Okay, and you can see this. There are few, I want to spend few minutes on this table. Okay, you can see in a diarrhea, vomiting, and dehydration, and fever also, your water content is reduced and solute concentration, you can see it is increased. So your typical specific gravity will show a higher result. Okay, diabetes mellitus, there will be a glucose in urine because of relative and absolute insulin deficiency. It will lead to osmotic diuresis. I have already discussed in my previous part, that is what is osmotic diuresis. Glucose will withdraw water due to its osmotic effect, so the specific gravity is also increased. In which typical range you are you can see in which typical range that is increasing. Okay, नेफ्रोटिक सिंड्रोम एंड प्रोटीन also, because प्रोटीन का अलग से एक डेंसिटी होता है. Okay, so whenever the protein is excreting in a urine, your overall urine density is very high. That's why the typical specific gravity is increased. Okay, right? डायबिटीज इंसिपिडस में क्या होता है? डायबिटीज इंसिपिडस में देयर विल बी लो एडीएच लेवल्स. ओके, व्हेनेवर द एडीएच लेवल विल बी लो, okay, your antidiuretic hormone is not at all working. Okay, so there will be a diluted passage of diluted urine, so it will ultimately going to reduce the relative solute concentration, so your typical specific gravity is reduced. Okay, chronic renal failure, there is a loss of concentrating power, so we have fixed specific gravity of urine, that is isostenuria. Early morning sample, you can take overnight sample, which is normal. Whenever you want to measure specific gravity, you should take early morning sample. Why? Because overnight concentration has already happened. Okay, so you have to take early morning sample. Just over the night आपने कुछ खाया पिया नहीं है, so there will be a overnight concentrating solid urine, and after excess of fluid intake there will be a diluting effect, so your specific gravity is ultimately low. Okay, I hope this thing is very clear. Okay, right? There are some questions, but I have already covered everything. Okay, so no need to focus on these questions, just go through it once. Okay, right? And you should know what is limitation of urinometer, because urinometer will need a large volume of urine. Okay, and this will be affecting by proteins and glucose, and it is very fragile, so and less precise reading is giving. Okay, so urinometer nowadays absolutely we are using in a UG labs also. Okay, in real time lab we are not using the urinometer. Okay, I have already told you what is isostenuria and its significant, and how does proteinuria affect the specific gravity. So false high positive आता है proteinuria में. Why? Because your overall density of the due to protein, it is increased. Okay, right? Why first morning sample is preferred, I have already discussed, because overnight concentration हो चुका है, तो आप वो sample ज़्यादा correct होगा. Right? Or all the things I have already discussed. Now you see this mannitol. What is mannitol? You have already discussed in your sugar carbohydrate chapters, like carbohydrate chemistry chapter. Mannitol is sugar alcohol. Okay, and this will exert osmotic effect, right? So whenever you are giving a mannitol, just like a डायबिटीज में जैसे बढ़ता था, मैनिटोल देने के बाद भी ऐसे भी ऑस्मोटिक डाययूरेसिस की वजह से यूरिन का स्पेसिफिक ग्रेविटी बढ़ जाता है. ओके, सो समरी में यू शुड नोट ओनली दिस थिंग. ओके, ओनली दिस मच इज इंपॉर्टेंट टू यू. बाकी सारा मैंने कंसेप्ट के लिए पढ़ाया आपको. ठीक है, यू कैन सी व्हाट इज डेफिनेशन. So ratio of urine density to ultimate water density. Normal range 1.01 to 1.024. Instruments urinometer 15 degree calibration होता है. Temperature correction you have to apply. You have already discussed. Influencing factor like solute load, hydration, tubular functions and ADH. Derived parameter उसमें से you can take a solid, total solids. How will you calculate? I have already discussed. Okay, and clinical use hydration assessment के लिए, then kidney concentrating function and differentiation of polyuria causes, and this will be learning, you will be learning in medicine classes. Okay, there is so many causes of polyuria, and this will be learning in you in a medicine classes. Okay, clear? Right, now let us go further more detail. What is the chemical composition of normal urine? Okay, now urea, normal excretion of urea is 25 to 30 grams per day. Urea is an end product of amino acid catabolism. So urea cycle is happening in the liver. It will represent 80 to 90% of total urinary nitrogen. Okay, So when you take high protein diet, your protein catabolism is more. So your ultimate nitrogen excretion is also more. Okay. Urea is reduced in liver disease or nephritis because there will be defect in urea cycle also, and that will be defect in kidney for in case of nephritis to excrete the urea. Uric acid normal excretion is 0.5 to 0.8 gram per day. It is an end product of purine catabolism. You will be learning in your purine classes. Xanthin is a starting product, and it ultimately result in the uric acid by xanthine oxidases. Okay, it is increasing the gout cytotoxic drug therapy like anti-cancer therapy also. This will be increased because all the cell will be dead by anti-cancer therapy. So ultimately your DNA and purine will be released by killing the cell. So ultimately purine metabolism ज़्यादा होता है, and purine metabolism, if at all it is more, uric acid has to be going to rise. Okay, serum uric acid is reduced. Urinary excretion of uric acid is reduced in case of renal failure. Okay, because tubules are not functioning properly. Creatine, it is 1 to 1.5 grams. So it is derived from creatine phosphate, energy stored in a muscle. Okay, so you can see there is a difference in creatine and creatinine. I will be discussing shortly. So excretion is proportional to the muscle mass, and hence it is used as a renal function marker. Creatinine clearance, we will derive it. Okay, you will be discussing this in a renal function test part in your biochemistry theory lectures. Ammonia, it is formed by renal tubular deamination of glutamine. Okay, acts as a urinary buffer, and this will maintain an acid base balance. This also you will be learning in acid base balance classes. Urinary ammonia is increased in metabolic acidosis. Important point to note, why we will be learning, okay, subsequently. Okay, so what is creatine? Creatine is a muscle energy molecule synthesized and stored as a phosphocreatine. And what is creatinine? It is a metabolic waste product formed by spontaneous cyclization of creatine phosphate and excreted in the urine, making it a gold standard method for renal function test. Okay, now what is non-nitrogenous constituents? Inorganic phosphate, ethyl sulfates, phosphate and chloride, they are non-ionic constituents. Okay, normal range you should, if आपको याद रहता है आप याद रखो, otherwise it is not necessary. Okay, origin and significance of inorganic sulfate will be derived from oxidation of sulfur containing amino acid like cysteine and methionine. Ethyl sulfatate is derived from conjugation with phenol, indole, skatol from the intestinal putrefaction, and then liver conjugation, and this is a marker of intestinal microbial activity. Okay, so this is important. Whenever the ethyl sulfate in the urine is high, your antimicrobial activity is reduced. Okay, I hope this thing is very clear. Antibiotic, when you are taking antibiotic, your ethyl sulfate is high, and why, that will be discussing in subsequent part. Okay, right. Phosphate from the dietary and bone metabolism, it will contribute a urinary buffering. And so chloride, it will reflect a dietary intake of sodium chloride, and this chloride is reduced in vomiting. Why? Because in the vomiting your HCl is going to be out in the vomit, so loss of HCl ultimately result in decreased urinary chloride. Okay, so now coming to main part, that is your test for normal urinary constituents. What are the tests? What are the different tests you are performing for normal urinary qualitative analysis? Okay, so first test, that is your urea, for the urea. Okay, and we have specific urease test for it. Okay, specific urease test for it. Okay, right. Now see, urease enzyme will catalyze a urea. Okay, this will catalyze a urea to ammonia and carbon dioxide, and this ammonia is alkaline in nature. This will convert a phenolphthalein to pink color in an alkaline pH medium. Okay, so procedure mein you have to take 2 ml of urine, and you have to add 1 drop of phenolphthalein to it, plus you have to add pinch of urease powder, and you have to wait for 5 to 10 minutes. You can see this is urease test. Okay, you can see this very nicely. This is a urease test. This is a positive test. Okay, because very nicely you can see the pink color is formed. Right. This is a urease test. Okay, so interpretation mein urea is present, you should note. Okay, so urease is a nickel containing enzyme, so its activity will be inhibited by heavy metals like copper and mercury. Okay, so whenever the urea is high in case of protein catabolism like fever, burns, and steroids, this urea is very high. Urinary urea is very high, and whenever the urea is reduced due to hepatic insufficiency, so urea is not going to be recycled. Okay, what is blood? That is urea nitrogen creatinine. UN is blood urea nitrogen and creatinine ratio. So in case of pre-renal, ratio is more, and renal ratio is normal. So what is pre-renal and renal? I'll just give you the summary. Okay, pre-renal means that condition that will impact a blood flow to the urine, and renal means actual renal conditions. Okay, azotemia means there is an increase in the blood urea nitrogen. Okay, so whenever your blood urea nitrogen to creatinine ratio is more than 20 is to 1, it is indicating a pre-renal condition. Suppose a shock in case of hypoperfusion. Shock is a pre-renal condition because blood supply to the kidney is reduced, and normally it is 10 to 15 is to 1 in intrinsic renal damages like chronic glomerulonephritis, chronic kidney disease, etc. Okay, I hope this thing is very clear. Second test is alkaline hypobromite test. Okay, you can see alkaline hypobromite test. Okay, very clearly, right? You can see alkaline hypobromite test. Sodium hypobromide oxidizes the urea, and this will ultimately liberate sodium, nitrogen and carbon dioxide. Okay, and this nitrogen gas actually will lead to effervescence. You can see here it is effervescent, and you can see the bubbles also present. Okay, so effervescence, this is of nitrogen gas, and this will indicate a positive test. I hope this thing is clear. So qualitative test, which is a qualitative test only, false positive result may occur with another nitrogenous waste. Okay, I hope this thing is very clear to you. Right now, there are two tests for uric acid. I will be discussing this test. Okay, so you can see there are two tests of uric acids. So first is Caraway's test, that is phosphotungstic acid test. Okay, in this test, principle will be your uric acid will reduce phosphotungstic acid to tungsten blue color in alkaline medium. Okay, I hope this thing is very clear. Okay, how will you perform this test? You have to take 2 ml of urine, and then you have to add 3 to 5 drops of uric acid reagent, and then you have to add a sodium bicarbonate sodium carbonate powder to provide a alkaline medium. So you can see deep blue color, you can see this very deep blue color. Okay, which will indicate a uric acid. Okay, so this will lead to positive result and strongly positive test, you can see, right? Now what is the biochemical basis of this test and what is the mechanism? So uric acid is a alloxan derivative and it is acting as a reducing agent. So reduction किसका होगा? Molybdenum and tungsten का. This will be a reduction reaction, and this reduction will form a blue color complex. Okay. So in a gout, there will be an increased uric acid. Tumor lysis syndrome is a clinical condition which is obviously seen after starting the chemotherapy. In leukemia patient, whenever you start the chemotherapy, larger amount of cell will be killed by that particular chemotherapy cytotoxic drugs. Okay, and this will release more and more amount of purines and pyrimidines, and that ultimately result in the metabolism, and ultimately that will be resulting in the uric acid levels. Okay, I hope this thing is clear. Right now, second test is a shift test. You can see it's a shift test. Uric acid will reduce ammoniacal AgNO3, and this will impart a metallic silver stain, that is a black stain. You can see in the filter paper. Okay, so this is a positive test. You can see also this is a black paper where there is a positive test. Okay, what you have to do in a shift test? You have to take 2 ml of urine and you have to add sodium bicarbonate to make the mixture alkaline. Then you have to pour this particular all solution in a filter paper, and then on the filter paper, you should be moistened with silver nitrate solution. Okay, so this will indicate a uric acid, which is a confirmatory test. Okay, right? Okay, so on ongoing our subsequent discussion, we want to measure a creatinine. Okay, for the creatinine, we have a Jaffe's test. Okay, Jaffe's test. What is the principle of this particular Jaffe's test? Okay, you can see in the screen that creatinine, whenever you combine creatinine with a picric acid in an alkaline medium, this will form a creatinine picrate, which is an orange red complex. You can see in the photograph, very nicely formed orange red complex. Okay, orange red complex. which will indicate a strong positive test. Okay, so this will lead to orange red color in a urine. Okay, how will you perform this particular test? So you have to take 2 ml of urine, and then you have to add 1 ml of standard picric acid solution, and then you have to add 40% of sodium hydroxide to make the solution alkaline. Okay, and then you can see this color, that is a orange red color. It is due to creatinine picrate. This will be asked in your viva questions. Okay, right? Why this is orange red color, you should be knowing, because many times examiner will ask you. Okay, what is the clinical application? So whenever you want to measure serum creatinine level, okay, you will take a standard assay, that is Jaffe's kinetic assay, to measure serum creatinine estimation. Okay, right? And whenever you are we are going to measure in our lab also, when we follow the colorimetry practicals, it is a Jaffe's method to measure serum creatinine. Okay, I hope things are very clear. What is you should know in advanced clinical points, like first, that is creatine clearance we are measuring. Okay, we have one formula for it. We have to measure urinary creatine upon, you have to take a plasma creatine or serum creatine levels into the volume of urine. This is a creatine clearance formula. Okay, and consider urinary creatinine also measures the estimated GFR, and normal value of estimated GFR is 90 to 120 ml per minute. Okay, right? So now this is a Wales test. You can see Wales test is also going to measure a creatinine, and where your creatinine is combined with sodium nitroprusside. Okay, in alkaline medium, it will leads to transiently bright red color. You can see at the bottom of test tube, transiently bright red color you can see. Okay, then ultimately this bright color is fade away and it will be forming a yellow color. Okay, and then how will you measure, how will you perform this test? You have to take 2 ml of urine, and then you have to add 5 drops of sodium nitroprusside, and you have to add 1 ml of 40% of sodium hydroxide to make the solution alkaline. Okay, so mechanism will be, the creatinine will form a nitrous nitroprusside complex by oxidation. Okay, so creatinine ultimately form an on oxidation reaction, it will form this complex, and this complex will impart a color. Okay, whenever there is increased excretion of creatinine, okay, urinary creatine, why? When there will be a myopathy, disease of muscle, fever, meat diet, because meat contains high amount of protein, right? And creatinine is an end product of protein catabolism. Where what is the cause of excretion? Paralysis and reduced excretion, paralysis and renal failure. Now, what are the sulfates? You should know what are the sulfates. Okay, so we have ethyl sulfate and neutral sulfates. Okay, neutral sulfates are derived from a sulfur containing amino acids like methionine and cysteine. Okay, important point to note. Ethyl sulfate test mein you should know the boiling of urine with HCl will liberate a phenolic conjugates, and when you add barium chloride to it, this will precipitate a white color precipitation by barium sulfate. You can see the white color turbidity here, very nicely formed turbidity. You can see, yes, you can see white color turbidity. Okay, this is due to barium sulfate. Okay, I hope this thing is clear. Barium sulfate की वजह से है ये turbidity, right? So ethyl sulfate test observation will be white turbidity and ethyl sulfate is present, that is positive test. It will reflect the intestinal putrefactive activity. So ethyl sulfate excretion is more whenever it is constipation, high protein diet and bacterial overgrowth. So in case of bacterial overgrowth, this will leads to the liberation of ethyl sulfates, okay, due to overgrowth of bacteria. Now neutral sulfate test, you can see, okay, principle of this test will be zinc whenever combines with hydrochloric acid, it will produce a H2S gas which blackens the lead acetate paper, that is lead sulfide. Okay, what you have to do for neutral sulfur test? You have to take 5 ml of urine, and then you have to add a pinch of zinc powder, and you have to add HCl on it, and you have to hold a filter paper, and okay, and you have to Dip it in a lead acetate at the mouth, and this particular filter paper will form a black color precipitate or black color. You can see this black color. So filter paper dipped in dilute hydrochloric acid shows a black stain of reduced silver. Okay, so I have already discussed neutral sulfate will be derived from sulfur containing amino acid, that is methionine and cysteine. So in case of obstructive jaundice, your taurocolate is a bile salt will contribute the sulfur fraction. Okay, I hope this thing is clear. Now hippuric acid. What is hippuric acid? Okay, right? It is formed by liver by conjugation of benzoic acid and glycine. Okay, so it is a marker of hepatic conjugation capacity. जिनोबायोटिक में आएगा फेज 2 डिटॉक्सिफिकेशन रिएक्शन में हेपेटिक कंजुगेशन होता है. सो हाउ मच द लिवर इज कंजुगेटिंग, this will be determined by urinary hippuric acid. Okay, so whenever hippuric acid, that is benzoyl glycine, reacts with ferric chloride in alkaline medium, it will form a creamy brown precipitate. Okay, you can see here, this is a creamy brown precipitate. I hope it is visible to you, creamy brown precipitate. Okay, I hope this thing is clear. Okay, I have discussed what is it, and it is clinically reduced in severe hepatic dysfunction and after benzoic acid ingestion or fruit diet, it will increases. Okay, clear? Urobilinogen, important point and important test to note. Okay, urobilinogen ka test. Okay, so urobilinogen, okay, it is formed by the heme catabolism. You will be learning in a hemoglobin chapter, right? Right, okay. Urobilinogen, when it is combined with para-dimethyl amino benzaldehyde, it will form a pink colored Schiff aldehyde complex. Okay, and this Schiff color aldehyde complex will be presenting as a faint pink color normally. Whenever urobilinogen in the urine is increased in amount, this will lead a very bright red color complex. Okay, right? You can see in the first picture it is very bright color complex, so it is strongly positive test. And in the hemolytic jaundice, your bilirubin turnover is more due to excess of hemolysis. Bilirubin is free in the blood, so it will go more rapidly in a catabolism, so that will be resulting in a high urinary excretion of urobilinogen. That's why ultimately you can see very strong positive nature, cherry red color of Ehrlich's test. Okay, right? You can see, but you can see in a normal part very faint pink color in a normal quantity, and you can see this also, it is very faint pink color. So normally this much urobilinism is present in normal range. Okay, so you can see in the hemolytic jaundice, your urobilinogen is more due to increased bilirubin turnover. Hepatic jaundice, that is problem in the liver, it is impaired conjugation, so partial accretion, so urobilinogen is also more. But in case of obstructive jaundice, it is absent, no, because no bile is reaching the intestine due to obstruction. Obstruction can be anywhere in your bile duct or biliary tree, like gallbladder stone or some gallbladder mass or gallbladder polyp or gallbladder carcinoma. Okay, so obstructive jaundice mein your urobilinogen, urinary urobilinogen is absolutely low or absent because no bile is reaching in the intestine. Okay, right? What are some advanced points you should know? I have made the points, you just go through it. That is urea cycle in the liver converts toxic ammonia to urea, and any enzyme defect in the urea cycle will lead to hyperammonemia, that is increased ammonia in the blood. Uric acid is strong antioxidant. Its elevation, that is hyperuricemia, may protect the neurons, but it will predispose the gout. Okay, this is latest research point. Okay, creatinine production is constant per muscle mass, thus it is used in EGFR formulas. Okay, ammonium excretion buffers acids and regulate the systemic pH. This is also I have discussed. And ethyl sulfate will represent a degree of bacterial putrefaction in intestine and detoxifying function of liver. Important point to note. What are the summary tables? You can see the summary very nicely. I have written the summary of all the tests. Okay, you can take the screenshot of it. I won't be discussing it here because of video length. You can take the screenshot of it, and you have to, whenever you have to revise, you can just revise by this one table. Okay, clear? Now let's discuss some viva questions. Okay, so what will differentiate pre-renal and renal azotemia biochemically? I have already discussed blood urea nitrogen, that will differentiate it. How does chronic liver disease affect urinary nitrogen profile? Because in a chronic liver disease, your urea cycle is defective. So there will be increase in ammonia and increase in aromated conjugates like ethyl sulfates. Okay, that is how this will affect a urinary nitrogen profile. What is isostenuria and its mechanism? I have already discussed. Okay, how the uric acid is acting as an antioxidant? I have already discussed that also. Okay, you can see uric acid scavenges singlet of oxygen and peroxynitrite, protecting against oxidative stress, but may form a crystals in joint. I will be discussing this part in our antioxidant chapters. Okay, that was very small topic. Okay, at the end of year you will be learning, but you should know that okay, uric acid is somewhat an antioxidant, but it will predispose gout. So why creatine remains reliable GFR marker even in hepatic dysfunction? Okay, because it is formed in a muscle independently of hepatic enzyme. Hepatic enzyme का कोई रोल नहीं है creatinine को बनाने के लिए, and it is excreted by glomerular filtration without a tubular reabsorption. That won't reabsorb, creatinine won't be reabsorbed in the kidney. Okay, right? But the excretion is happening. Okay, so that's why creatinine is a reliable marker. Okay, how does antibiotic affect the urinary ethyl sulfate excretion? I have already discussed. Due to suppression of intestinal bacterial flora. If you give antibiotic, the intestinal flora will be reduced because antibiotic will gonna kill all the good bacteria also. So it will reduce the phenol and indole formation, right? What is the molecular basis of Ehrlich test and color reaction? I have already discussed it. Okay, right? Azomethane linkage under between urobilinogen and aldehyde group that will form a color. Why standing of urine becomes alkaline with precipitation? Because urease positive bacteria will form ammonia, and this will increase the pH, and that will be leading a precipitation of some ions like calcium, magnesium, phosphate, carbonate salts, and this will impart a turbidity. I have already discussed. So what are the pseudo chromosomes in Jaffe's reaction? So what are the pseudo substances which will indicate false Jaffe reactions, false elevation like glucose, ketone bodies, ascorbic acid, cephalosporin antibiotics will interfere a color formation and causing a false elevation. And what happens to urinary urea levels in hepatic failure? I have already discussed it. Okay, so here we conclude our practical. Okay, right? This is very long practical actually, but I have covered almost all the points that should be important in your viva. Okay, beyond that no one is going to ask you at this level. Okay, so you will read it. Okay, read, revise, and if you have any doubts you can contact me directly also. Okay, thank you so much for patience listening. If you have any doubt, post it in a comment section. Okay, best of luck for your exams and happy reading. Thank you so much.